Hi, my name is Tracy. I have been coming to Dr. Jody for some other treatments. Specifically, when I first came, it was due to adrenal fatigue, and I'm a cyclist and a person who's very active and works out quite a bit. And I had for 3 months been told that I couldn't do anything because with the adrenal fatigue, they said that every time I did any activity, my heart rate was racing, and it was going to 100% maximum and above, and that I had to stop all activity. And then I was warned that I would very likely never be able to get back on my bike again. But through some treatment that Dr. Jody has done in a really short time, after a matter of about 2 weeks, he set me up on my bike, and doing brain activity drills I was able to start at 5 miles a day riding. And that's a very small amount to me, but I was on my bike and he was doing it for my enjoyment and to see if I could work on my brain at the same time. After the first week, he brought me up to 15 miles a day, and successfully completed that week without any negative or bad about my brain, and I've actually strengthened in certain departments. And in the midst of doing some of the treatment that he's doing, we touched on a subject that's been an embarrassment and bothered me for years. I'm in business, and it's very important for me to deal with customers on a one-on-one basis. But I had an issue where I could talk to them, and I could talk to them in depth for half an hour, but they would leave, and when they would come back into my business, I would never be able to recognize their face. And I have noticed for 20 years, I've had the worst face recognition. I could notice other things about them, their voice, or perhaps what they're wearing, but I just could not recognize a face. So I told Dr. Jody this, and he started working on a part of my brain specifically for face recognition. And that was about a week and a half ago, and only one treatment ago, to be honest. This is the second one of that. And I have just been gone to a hospital with my aunt who was in surgery, and my family members were in depth talking to an anesthesiologist, but I wasn't. I was filling out paperwork and doing other things, and I had come in and just talked to the anesthesiologist for 1.5 minutes, maybe 2 minutes at the most. And then my aunt went into surgery, and the next day I was walking down the corridor in the hospital with my mother and my aunt, and as we were walking by the doctor, I recognized that it was the anesthesiologist, and I said, "Oh, how did Sheila go yesterday? Have you seen her yet today?" And my mother and my aunt both said to me, "Who is that?" And I said, "Well, that's the anesthesiologist that you had been speaking to yesterday." And as I walked past him, I thought, holy crud. I was the only one that recognized his face, and immediately upon walking up to him at about a maybe 15-yard distance, I recognized who he was. And that was amazing for me because, trust me, this has been an embarrassment for me forever. So don't know really what else to say about that, but that was very exciting for me. I'm progressing in my treatment in other directions, and I'm very excited about it, and I'm so excited Dr. Jody's stating that I will not have to give up my bike, and he foresees that my brain will get stronger and I will be able to do more cycling and more activities. I'm not yet sure about racing because patience is not my virtue, but I'm having to learn that, and he's going to take me along this treatment. I have very much noticed when I've been cycling now that Dr. Jody is letting me get back on my bike and doing brain activity, it has really, really improved the situation I have with my heart. The reason that I had to stop cycling when my whole circuit board was going crashing and I was going crazy is that every time I did any cycling or any activity, my heart for about the last year had been skyrocketing. I would be 2 minutes into the activity, and where other people that I cycle with would be at 125 beats per minute, I would be at 170 or 178, or if I was even trying to push it, I would be past maximum. I'd be about 182. And it was, if I stopped the exercise, my heart was in condition, it would lower, but any form of exercising, it was skyrocketing. And they said that I was very, very susceptible to a stroke. And that is why I had to stop. And when they told me to stop, it was skid stop. You can do nothing. Well, since Dr. Jody has been letting me cycle more, I have been wearing my heart rate monitor, and I have noticed greatly that the beats per minute on my heartbeat is so much lower. As I'm just doing a soft pedaling, it's at the 95, 96, 97. If I'm trying to aggressively push it a little bit more, though I'm not pushing it hard, I am at 108 to 115. At that same type of effort before, for the last year of riding, it was a good 30% to up 40% more. I could barely ride and keep it under 145 to 150 at any activity. So I feel so much safer. I feel so much peace of mind safer of doing an activity and not worrying that I'm going to stroke myself out. And it is for the first time, I can tell you, in years, I realized that doing the activity, I do not have to be feeling my heartbeat in my eardrums. That it's beating so hard and so uncomfortably, but I still was doing the activity because I did not know that that was not normal. Did not know that my heart was just not in shape and just a loud, fast, obnoxious heart. But it is so much more comfortable, and it is so much peace of mind, and I just feel so much healthier doing it. So.